Hi, I'm Chung, Chief Medical Officer of Joint Pediatric Enterprise of Children's Health and UT Southwestern Medical Center. And welcome to the In the Know video series. Good afternoon. I'm really delighted to have here today Dr. Jorge Bezerra, who's a professor and chair in the Department of Pediatrics. Welcome, Jorge.
Thank you very much.
It's been, a little over a year?
Just about a year, that's right.
What has it been like?
I thought it was going to be good, but I think that it's much better.
What's in the near future? Now, you've been here a little over a year. There's so many projects and initiatives and vision and mission and goals. What is just around the corner that we should be expecting?
I'm excited about the day that we live in today, which is artificial intelligence, everything. Can we use the principles of artificial intelligence to improve access to care? Using digital health, how can we be close to the patient using the means that we all use every day? Second, how can we actually use the data that we have to tailor the type of care? When is the patient needing to have this level of care versus that? Is this patient ready to go home? So there are many technologies that we are aware of and we want to explore. How can we use them to improve the care that we provide?
Yeah, I mean, you said it. In many ways, it's sort of marrying all these scientific and medical advances that our place has to offer and marry that with all the great patient-centered experience and accessibility and being able to provide this concierge service.
Yeah,
I mean, I think that's what we're all striving for,
Yeah, I like to think that we can be a one-stop place, a hub of specialists, pediatricians, specialists, surgical colleagues, anesthesiologists, radiologists, all bringing that scope of care. One stop, many choices with a single goal, right? Personalized care, what the child needs.
Yeah, and we're so excited and blessed that you're here providing that leadership. And so in over past 13 months, what are some of the things that kind of caught you surprised?
I found that, Susan and I found that Dallas, the greater Dallas, is populated by individuals that have great hospitality and they have a can-do attitude. And this attitude is all here. I am so glad to see that there is a real commitment by both institutions to make sure that we are not just providing care in one hub, but that we go to the neighborhoods, bring the care close to where the families are. I'm so glad to see that this is a culture of inclusivity, and physicians, advanced providers know and value the partnership with all members of the enterprise.
No, for sure. And the partnership and working with you has just been an incredible joy. What keeps you up at night?
What else can we do to help our faculty aspire? We have been able to hire over 70 new providers. So are we fostering their well-being so that they can fulfill their professional dreams, right? But this does not keep me up. It keeps me up for excitement. And how can we work collaboratively? We have a huge responsibility. Remove obstacles so that they can march on.
Right.
The fact that the times that I deliver care in my clinic, when I go to the clinic, see a patient, I see 5, 6, 10. Children's is UT Southwestern fully committed to population health.
Yeah.
So Children's has a presence in over 200 schools in the community, making sure that the kids that go to school are happy, are learning. Children's and UT Southwestern are partnering to develop the Children's Health Pediatric Population Center. Imagine thinking about what are the determinants in the environment, in the family, in the surroundings that contribute to care? Why is it that one child with asthma or sickle cell disease come to the emergency room every other month? They should not be coming. What is it where do they live? What else is happening that we can help? So I think these are the things that perhaps maybe keep me up at night, but not as disappointment, but excitement, because we are going to make it different. We're going to improve it.
It's great to hear. It's in some ways even beyond more than the patients that are showing up to our hospitals or clinics.
Yeah.
It's really about all the kids' lives in the community and region that we want to be an innovator and we want to be able to really make positive impact. That's so important. I mean, we're great as a tertiary quaternary hospital, but boy, what would it mean to the community if we can actually provide prevention, disease progressions, and early detections?
This is just a wonderful comment, because we both believe that the way to invest in the future of Texas, United States, and the world is to invest in kids. And I know that this is such an engaging community that if we are looking at the health of children in the community, and we find that they have specific mental health needs, or they need specific help in the environment, we can engage a rich philanthropic community to help us develop the resources to do that.
Yeah.
Another point of pride, both Children's Health and UT Southwestern are constantly engaging the community leaders, making sure that we gather the resources, whatever it takes, for us to help kids. If the kids are healthy, imagine what the future will look like.
Absolutely. I mean, all this stuff that you just mentioned and we're talking about, hey, you're just a true great leader. You're talking about the vision and how to making a difference. And so, Georgie, let's talk about how Children's Health and UT Southwestern, the two great institutions in different ways, with long history, are coming together to be the best at what we do for pediatric care.
Yeah, you have two exceptional environments. One that is known for it and has a tradition of pursuing excellence, discovering the causes of disease, what drives human health or what drives disease. We have Nobel laureates that inspire us in the environment. We walk through members of the National Academy of Medicine or Howard Hughes investigators, and very talented trainees. They have an array of technologies that are very empowering. And then we have a clinical environment, a Children's Health, all of its site. It is an exceptional environment of team-based care. If you unite those two, it's 1 + 1 = 10. 1 + 1 = 100. Because you bring this innovation in the clinical care, has to have that type of combination and commitment. Now there are two other components that make it quite unique. One is that we force ourselves to use research to improve clinical care, new diagnostics, new treatments, personalized care. And second, we have a finite life, and we actually spend quite a bit of time training the future clinicians, the future leaders of the field. So putting these two together is really an exponential impact on. One of my dreams is that we can actually develop mini human organs to replace an organ when it fails. For example, I'm a hepatologist, and I'm pretty confident it's just a matter of time. We'll be able to build bile ducts or mini livers, to actually be able to help the patient bridge if they have a liver failure, to a transplantation, or perhaps to replace a missing function. Today we look at dialysis in this big machine, and the blood goes and flows different components. Maybe the dialysis of the future will have mini kidneys,
Yeah.
right? Filtering the blood. Maybe it's small, since it's a functional kidney, they can carry it and have a pretty darn good life. 5 years from now, look back and we find a faculty that feel very empowered, but with specific points of pride, marquee programs, destination centers. We aspire to serve the needs of the healthcare needs for all children in northern Texas and beyond. The fact is that Texas as a whole, as a state, they invest on this population and these universities, these hospitals, wherever they are. We want to make sure that we develop the type of expertise here that we can serve the kids wherever they are. Yeah. If we can offer, if we have what they want, we'll welcome them to come. So I think that the ability to know that the team is vibrant, that they have developed additional opportunities to better serve the kids, and I think we will probably be, it was good looking back.
Yeah, I think so. And Georgie, in just a brief year period, it's been a great being your partner, and I think we got a lot more exciting things ahead.
Yes, I feel the same way. Thank you very much.
Thank you for being here.